Responding to medical emergencies is and always will be an important part of the job of EMTs and paramedics. But many 911 calls aren't true emergencies that require immediate care in a hospital emergency department.
My name is Adam Strode. I'm a paramedic in Fort Worth for MedStar. I'm a mobile healthcare paramedic. After transporting patients to the hospital for a number of years, you start to realize that a lot of the folks don't really need 911 response for their complaints, that they would be better served going to clinics, to their primary care doctors. You know, some of them just need medication refills, things like that.
To get patients to the right level of care, EMS agencies nationwide are teaming up with hospitals, physicians, home health care, hospice, and mental health agencies to do more than answer 911 calls.
Hey. Well, good morning. How you doing?
Pretty good. How about you?
Pretty good. How you been feeling?
Pretty good.
Good. So you said you've been doing okay?
Yeah, so far.
Good. Haven't had any chest pain, shortness of breath, anything like that?
These new partnerships are called Mobile Integrated Healthcare, and they're bringing a patient-centered approach into their communities.
Hello, this is Susan. I'm the registered nurse here at MedStar.
Mobile Integrated Healthcare can include having a nurse provide phone advice to non-urgent 911 calls instead of sending an ambulance.
We're going to go through some questions and find the most appropriate location for your care today.
Or having EMTs and paramedics make house calls.
So the beauty of a mobile integrated healthcare environment that is done well is that, number one, we begin with that community needs assessment. So all physicians, nurses, home health, pharmacy, that whole group is around the table at the beginning when we begin the conversation about what does our community need. And then it becomes very obvious that nobody is trying to infringe on other territory. We are simply trying to fill gaps in the community.
With Mobile Integrated Healthcare, partnerships are key. In Fort Worth, MedStar paramedics work closely with home health nurses.
And our partnership allows us to enter into their database all of our patients within their service area, so that when our patient calls 911, the MedStar team is notified that it's a Claris home health patient, and they call the on-call nurse, whether it's 3 o'clock in the morning or 2 o'clock in the afternoon or whenever it is. And that nurse and that paramedic can then work together to triage that patient in the most effective way that helps that patient.
MedStar also partners with JPS Health Network, the county's safety net hospital system.
JPS saw an opportunity to extend our reach into the community with MedStar. They are implementing a community health paramedicine program where they go into the home and are able to assess things we will never see in the hospital. They're able to assess how people get to primary care. They're able to assess diet and what's really happening in the home, not necessarily what they tell the doctor, and really extend the reach of the hospital to meet people where they are and help to change behaviors.
I was diagnosed with gastroparesis in my late 20s, and I went from living a full active life, to basically trying to hold on to life.
He was literally calling us every day to take him up to the hospital because of the severe amount of pain that he was in, followed with vomiting and dehydration. It was just complete misery for him.
There was a caseworker at the hospital who took note of the frequency of which I was visiting the ER, as well as the frequency of me being admitted. And she referred me to the program. And on the first night that the paramedic came to visit me, you know, it was a straight to the point. It's like, you know, if you want to get better, we'll help you.
We worked with him diligently, trying to help him understand, first off, the condition. One of the things that we talked with him about was really managing how he ate, becoming more active, and getting him off of the pain meds.
It was a sense of reciprocity. To see that they had hope in me, that I would get better, gave me hope that I can.
When we see how well an individual like Antoine is doing, it gives us great satisfaction knowing that this works. This is preventative medicine in action.
I'm still symptomatic, but knowing how to manage it, you know, makes all the difference. I haven't been to the hospital in months. I haven't taken any pain medicine in months. no nausea medicine in months, and it feels good. It is a sense of deliverance.
Programs like the one in Fort Worth trace their origins to community paramedicine programs in rural areas of Maine, Minnesota, Colorado, and Canada. In rural areas, long distances, a lack of physicians, and poverty can make it difficult for patients to access primary care. By offering paramedics additional training in skills such as in-depth patient assessments, medication reconciliation, patient navigation, and educating patients about managing chronic conditions,
paramedics from North Memorial will soon begin a groundbreaking program that could take some stress off the healthcare system.
EMS leaders saw a way that a new type of practitioner, the community paramedic, could help fill those gaps.
They are within the community. They know what the resource needs are in the community relative to access to health care in particular, and they're ready to step up to the plate and provide this additional component of health care as part of a medical home. And they function actually under the licensure of a primary care physician. They're the eyes, the ears, the hands of this physician as they do their work within the communities. And they become a very important member of that medical team to handle the population's healthcare needs.
That's good for patients, but it's also important to a healthcare system trying to improve patient outcomes and control costs.
The average cost of a patient going back to the hospital in our area in Tarrant County, released recently in a study for congestive heart failure, is $9,203. So every time we can partner with MedStar or have our nurse go and see a patient for CHF and treat those symptoms and keep them in the home, we've just saved the healthcare system $9,203.
Instead of being paid to take patients to the hospital, which is traditionally how EMS is reimbursed, mobile integrated healthcare programs compensate EMS for taking care of patients outside the hospital.
We've really structured this program to be outcome focused. So if we really get folks into primary care and avoid those unnecessary emergency department visits, we all share in an outcome pool that's awarded to both MedStar and JPS Health Network.
That's the future for EMS, getting paid to prevent a 911 call.
Your blood sugar's fine, it's 114, so that's that's real good.
At the hospital, of course, you're bombarded by all that information. And with MedStar, you know, they come into your home, your own environment, and they'll go ahead and just sit there with you and take it step by step. They give you a lot of information that, you know, that you can be taking that and just changing your life.
And I feel like we can really make a difference in these people's lives. Really, a lot of it is just through education. Just sitting down with them and making sure that they understand their disease processes and make sure that they understand what is an actual emergency call and what could be handled by going, say, to a clinic or to their primary care doctor, rather than utilizing 911 to go to the hospital.